Hi everybody! So I am making a video on intro to dissection just to get everybody started and working with their rabbit specimen. So first off, whenever we begin dissection, we want to make sure we're in a well-ventilated area, either a window cracked, fan open, something to kind of keep that preservative smell from bothering your face or eyes. Really the concern is irritation. Whenever we take our specimen out, it will be in 2 bags. It will need to go back into both of those bags when we are done using it, every time we're done using it, just because we want to be sure not to lose moisture. Once all of the muscle tissue starts to dry out, the more we work with it, the harder it is to sort of work with it, the less pliable it becomes. So double bagged every time we're done using him and seal up that bag just to keep in moisture. We will be using the same rabbit specimen in part 2 for blood vessel dissection. Right now what we're doing is skeletal muscle dissection, so a lot of the areas we are touching on or dissecting or working through will not actually interfere with our blood vessels. They're a lot deeper. There's a couple areas I'll touch on where you should be a little bit careful to try and preserve some of those veins and arteries. So I'm going to get started on the lower section. I always recommend beginning with the lower limbs. I think their muscle groups are a lot easier to see just because they are so large. And you can see a lot of the muscle borders are very easy to sort of work out. I've already removed some of the connective tissue over top of this thigh. If you want to look on the other side, we can see a couple areas where there is still some connective tissue left. Whenever we're looking at fascia, it will be clear or opaque a little bit and have a very easy time pulling away from the body. One of the other connective tissues we'll have excess of, like right here, is a little bit of fat tissue. Fat tissue will look yellow or dark brown, and again, will remove pretty easily from the body. I have a nice big fat deposit right here. If we are looking at muscle tissue, it will not pull away from the body so nicely or easily as this. And actually, I'm going to start working in my gluteus region just to show you the difference between cleaned off muscle and muscle that still has some of that fascia remaining. So I like to start in the lower limbs. A lot of the bigger muscle groups, we don't have to worry about blood vessel avoidance. Right here at the top of the hip. Before I go into naming muscles, I should also say our rabbits are completely 100% skinned, pretty much everywhere except for their head and paws. Meaning sometimes we have very, very little cleanup to do. A lot of the musculature, especially the superficial skeletal musculature, is very present. So when I say dissection, sometimes our dissection is merely just separating those muscles out by their borders. We do need to make sure we clean up though. It depends on kind of how fat your rabbit was overall. Really, there will be different amounts of connective tissue and anatomical variation with each of our rabbit specimen. But this is a really good example right here of brown fat and yellow fat. And again, to see the abdominal muscles, I'm going to want to remove all of this tissue. When I am dissecting, I mainly work with my probe, my forceps, tweezers, or my fingers. A lot of what we do is separating and observing, so it doesn't actually require a whole lot of cutting. And a lot of our very loose connective tissue like this, like fat, like a little bit of that areolar connective tissue, will pull away much easier. And then we can reveal our muscle tissue below. And right here on the abdominal wall, our external abdominal oblique and rectus abdominis are pretty visible already without doing any cutting. I am going to open up the suture sort of down the middle where they were injecting the hepatic portal system of the rabbit. I would encourage you to do the same just for cutting your abdominal wall and looking at those abdominal muscles easier. I have a lot of fat on the one side still left, and a little bit of that skin connective tissue. Cutting open the inner abdominal wall kind of makes separating those abdominal layers out just a little bit easier. By getting rid of the connective tissue on the exterior, we can start to see some of those muscle striations. When we are separating the abdominal wall, the exterior abdominal obliques, so giving orientation, the exterior abdominal obliques will run towards the midline, towards and down the midline of the body. When we start picking these abdominal layers apart, and again, right at that suture is a great spot to start working because they've already made the cut for you. That fiber orientation is really what's going to help us decide where rectus abdominis, where our internal versus our external abdominal obliques are, and where our transverse abdominal oblique is, transversus abdominis. And when you find a nice muscle border, start working from that spot that you think is easiest to work at. Nothing says you have to start with the lower leg muscles. If you see an insertion or an origin along one of your arm muscles, that would be a good spot to start. It's really about making yourself comfortable with those first few incisions, those first few sort of poking around. So when I found my border, I was able to separate my external oblique from, and I'll put my hand right in there, my internal abdominal obliques and rectus abdominis, running straight up the abdominal wall. I'm going to kind of move right back into my thighs from this aspect. I have some nice fatty tissue along the superior border of my hip that I'm going to remove. And this muscle right up here, again, we have gluteus medius. Nice big rounded guy making up the superior portion right in the line of that hip bone. Below him we have gluteus maximus. Gluteus maximus kind of makes this almost cup shape. There's two lobes that kind of hold on to gluteus medius below. Right down from him, this massive muscle right here. And I will work on getting his border out from the other side on this aspect. This is all biceps femoris. Now what I'm going to do is cut off his connective tissue at the kneecap where he is inserted. This way I will be able to retract him back and see all of the leg muscles deep to him. And in order to do that, I'm just going to run my probe right up along his border. And try to be very careful about nicking or ripping too much. Once I can get my finger underneath, he will pull right from all of his different insertions. And then we can look at those nice internal leg muscles also. A nice big fatty deposit right there that I will work on removing. This is one of the few regions on the leg you want to be just a little bit careful with. I am taking some of these blood vessels out. But you can still see some of the popliteus in there. Nice running right underneath the kneecap, sorry, right there. And then on the internal side, the ones we're going to be careful about are going to be those femoral veins and arteries. And usually those are very, very obvious. And a great sort of divider right down the center of the internal thigh. This guy right there. All right. Biceps femoris pulled back right here. If I take a look internally, I can see vastus lateralis. I can see the top portion of tensor fasciae lata. This is a great comparison of muscle tissue to fascia. I have cut off most of this big IT band right here, but tensor is a nice check mark muscle up at the very, very corner of the thigh that attaches to this big IT band, which keeps the thigh nice and taut. So pushing him down, we can see this large muscle in here that's pulling straight downwards from the knee. And I'll stick my finger right around him in there. This guy is semitendinosus. He's nice and long and thin. He's one of our hamstring muscles. And from this angle, we have an excellent view of the gastrocnemius. Normally in articulation, he's a little bit hidden by biceps femoris. If we move biceps femoris away, though, we can see that nice big rounded bilobed muscle. This is the gastrocnemius. If you move the ankle joint, you can see that nice big Achilles tendon or the calcaneal tendon. The gastrocs and soleus are entirely for plantar flexion, and both of them work with that tendon to point the toes. So deep to the gastroc, I can separate him out right there. Deep to the gastroc, we have this little flat muscle on the interior side called the soleus. Now the gastroc is nice and big and meaty, and he is the more superficial one. He's bilobed, and on the human body, this is that nice muscle that when you stand on your tippy toes looks kind of like a heart or an apple at the very bottom. That is the gastroc, the muscle with the much larger bellies. The soleus is this little guy. Hold that down. This little guy right in here, inlaying the gastroc. Both of them, again, plantar flexion, pointed toes. In opposition, dorsiflexion. Up top here, we have tibialis anterior. There is very, very little fascia or connective tissue on his exterior. Pretty much, I can just pinch a little bit of this right off. And there you have it. Tibialis anterior, our nice muscle right on top of that shin bone or the tibia. I can put my whole probe right under him. Looking at the interior of the thigh, I have some more fatty tissue, and I have some very well vascularized muscles to kind of give me a guideline for where I am. This guy right here is adductor longus. On pretty much all of our rabbits, he will be nice and very, very pink. Now I'm going to work to get some of that exterior connective tissue off. Look at some of those thigh muscles. And then we'll look at a couple of our upper extremity muscles. So one of the places I like to start, again, right on adductor longus, that nice, very, very pink, dark muscle. I just basically stick my probe in along him and try and run it down as far as I can until I begin to see muscle tissue. Now, this guy right here, this big, thin muscle, making up the posterior aspect of the internal thigh, kind of looks like a thumbprint, is the gracilis. And I'm going to do to him exactly what I did to biceps femoris. I'm going to find all of his borders, and you can sort of see exactly where the tip of my finger is running. This is his border. He looks like a thumbprint on the inside. And pulled away, you can actually very clearly see where there is no muscle tissue. Nice green of my glove. And muscle tissue. Fibers from that gracilis muscle. So once I have his border nice and cleaned off, I'm going to resect him, which means I'm going to cut off his insertion to that knee. Just so that when I look at this thigh, I can nicely flip him back and begin to look at some of the other internal thigh muscles. So above our superficial gracilis, making up the internal side of the thigh superficially, this is the sartorius, this straight line right down here. And then this guy is going to be rectus femoris. And you can see a little bit of rectus or vastus medialis on the interior. Those guys are quad muscles, and the sartorius is a thigh stabilizing muscle. So once I get them separated, we will take a quick look at those. Alright, so gracilis, flap him right down. He's the most superficial. Sartorius, this guy right here, dead center. Rectus femoris, this one lifting up off the top. And then vastus medialis, the interior thigh muscle right there. Underneath gracilis, and sort of working away from abductor longus. Adductor longus, these guys pull the thigh in towards the body, the midline. We have adductor magnus, or adductor femoris. And then the biggest internal thigh muscle that I will separate from the other guys, this one, semimembranosus. He's big and flat. And again, adductor longus right here, adductor magnus, semimembranosus, and semitendinosus running dead along the back of the thigh. Okay, any of the tissue that I remove, any of the fat tissue or fascia, I will throw directly into the garbage. And working my way up, I'm going to look a little bit at the shoulder and the upper arm. So a few of the muscles we need to look at up here on the very exterior of the back are the trapezius. So on this side, we still have some fat, which we can see right here, this nice yellowy tissue. Nice fat deposit right there as well. And we have all this connective tissue on the inside of the shoulder, which means if we can see the internal portion of that shoulder, our trapezius muscle has ripped. Trapezius muscles are very, very thin on the rabbit. They overlay everything. So if I look over to this side where some of it has already ripped a little bit, I will pull up very gently before removing it. This is all trapezius muscle. So basically from this point around the shoulder up to the base of the neck, right in here, this region before it was ripped off, right here. Clavotrapezius, moving down. Acromiotrapezius, right there on the point of the shoulder, the acromion region. And then lastly, the spinotrapezius. Nice thin muscle along the spine. They are very, very thin, but you can see the fibers running amidst that connective tissue. While we have the shoulder nice and open over on this side, I'll move this little bit of clavotrapezius that's left over out of the way. In here, we have our rhomboid muscles. These are our deep shoulder muscles. So, right up top, we've got rhomboideus capitis, rhomboid major, and rhomboid minor, right down at the base in there. We can also see our subscapularis. This is the muscle that inlays the scapula bone entirely. Flipping over and putting his arm flat, we can still see the scapula clearly. And on our scapula, we have our acromiodeltoid. We also have our supraspinatus, above the spine of the scapula, a nice muscle at the top of the shoulder. Again, this side has the trapezius muscles removed. Then we have the infraspinatus below the spine of the scapula. And lastly, I want to look at a couple of our larger arm muscles. I have some nice connective tissue built up on the outside of the arm, which I'm just going to work on picking away. We can already see a nice muscle border forming. This is going to be the lateral, away from the midline of the body, head of triceps brachii. And triceps brachii is our forearm extender, our forearm extensing muscle. So lateral head, right there. And triceps just means there are 3 heads, so the lateral head is one portion of that muscle. This guy right back here, this is the long head of triceps brachii. He makes up the bulk of the back of the arm. Up front, moving around a little bit. I'm going to start to uncover biceps brachii. Biceps brachii is our arm flexor, our forearm flexor. So he works in opposition of the triceps. So, makes sense. He's on the opposite aspect of the arm. Okay, and there we have biceps brachii. And on the internal side of the arm, we also have the brachialis. So basically, the composition of the forearm, or the upper arm, sorry, is biceps. Triceps are, biceps on the anterior portion, the front of the arm to flex the forearm. The brachialis in between, we're still in the brachial region. And then the triceps on the posterior aspect of the arm to extend that forearm. Structurally, this is the same in the human body. I am going to conclude this video right here with a few examples of the lower limb dissection and the upper limb dissection. Please message with any questions and progress pictures as we move along. Whenever we clean up from dissection, we make sure to wash all of our surfaces down, wash our hands, and then our bunny rabbit goes headfirst back into both bags. Thank you.